We're going to do a little bit more soft tissue work here, just tying into Anna's shoulder, arm, forearm, wrist complaints. So one thing I'm looking at with this is that her shoulder doesn't move a whole lot here with some elbow flexion and extension. Really, I would prefer it not to move at all. So what you'll see a lot in desk workers, computer workers, people that use their arms a lot in front of them, is that the bicep gets so tight that it can shift the shoulder forward and back. So just is going to lead to poor mechanics of the shoulder, and easy thing for us to work on and start to loosen up in the clinic. Same thing as before, we're finding those tight spots in the muscles and helping to loosen them up, help them slide alongside each other a little better. Doing all right here? Mm-hmm. Didn't seem like that was ticklish at all.
No, it's not ticklish. It's sore.
So there's a whole lot of tension here between her bicep and tricep area, between the couple layers of the biceps. So we're looking to clean that up a little bit, helping take some of that mechanical stress off her shoulder joint that's feeding there from the bicep muscle here. So not too bad up there. Continuing our myofascial release treatment, we are going to work through Anna's wrist and forearm here. Okay, I'm going to start here. Now straighten your elbow for me. Just kind of push it forward. Perfect. One thing you'll see a lot of is the muscle that we're working on right now. It's called the pronator teres. It can be pretty heavily involved in a lot of carpal tunnel cases. So we've got a nerve that runs down the front of the arm there, and this muscle that goes across it that way. So the muscle will lie over the top, and when it gets tight, if you're doing a lot of work in this sort of position, so either typing or an ultrasound tech pushing from here. And so anytime where you've got this arm forward and engaged and pushing is going to lead to some overuse through there and can lead to some nerve symptoms down into the wrist and the fingers. And now straighten that elbow for me. Great. Same thing. Very good. Sore there? So I'm rolling over. I don't know if you can tell from the video, but I can roll over this little bump in here. That's a nerve, so I'm on her radial nerve there. Shouldn't be sore unless it's been irritated. She's got a little bit of soreness there. So we're going to follow the path of that nerve, look for any soft tissue, any muscle tension around it, and when we find some spots that could be interfering with how that nerve should glide, we're going to loosen them up. And make a fist, but grab your thumb in it, and just relax there. Now straighten your elbow. Keep your shoulder back for me. Same thing. Sore spot. Given that she's got some neck issues with her job as an ultrasound tech, we're going to break off into some of the upper back, shoulder, neck muscles here and some myofascial release. So I'm going to start on what's called the levator scapula muscle, and here's what that looks like. So I'm going to take this arm, I'm going to have you reach it over, set it on your other knee for me there, and then we are going to take your head down towards your left armpit. Give it a good whiff. The whiff is important. It helps with relaxing all of the muscles in your body, unless you just went on a run this morning like Anna did.
Then it's extra important.
It's important to fake the whiff. Come back there. Okay. And just relax here. going to work a little higher up into the neck. We're going to take your head down. There's a couple things to watch out for when we're working in the back of the shoulder blade area. I'll have a lot of people that find this knot inside their shoulder blade that we're feeling right here on Anna. As you can see, it feels like a really sore spot, but that's actually a nerve. So if it's something that you can thump over and roll over like I did in her forearm earlier, it's probably a nerve, and you don't want to dig into it. So just beating up on that nerve is going to keep it sore. It might feel good temporarily, but it's not going to make a difference in the long run, and you're probably doing more harm than good. So don't find that spot inside the shoulder blade. You want to make sure you are on a muscle and not the nerve, and you should feel better the more you do it, not worse. Okay, just bring this arm back, elbow to your side, and I'm going to have you reach straight forward there, relative to your body. There we go. We're going to do that one again. You were like, okay. Bring this arm back here, and I'm going to have you reach straight forward there. Really get this shoulder blade moving. Good. And come back, and reach again. Come back, reach again. Come back, reach again. Hold that one. Reach more, push, push, push. Good. Grab your arm, pull it across your chest. Great, come back down, pull again there. Good, come back,